I think what occupational therapy is doing well is that we are such a unique field with a very unique skill set that really allows us to be a strong partner with others in whatever setting we are and continue to bring our distinct value and purpose into those spaces to help the people that we're working with.
We strive to just give everything that we do to all of that partake in occupational therapy services, in addition to some really rigorous evidence-based practice, looking at opportunities just systems-wide to make occupational therapy accessible is things that we initiate conversations on that I think that we do really well.
The profession of occupational therapy has always been a critical field that helps people of every age and every stage of life. However, we have several areas of improvement. First, we need to increase the public awareness of occupational therapy's value, and we need to bridge the gap in between occupational therapy and the general public, highlighting our distinct value.
We could be branding, pitching, and really defining occupational therapy so that it becomes a household concept, that people understand what it is that we do.
I think another kind of big change that I've definitely been seeing is what our role is within the healthcare system as well as the education system. We all know what we've done since the inception of our profession, but really taking a look at how that's expanding, changing, how we're growing in our use of our practice in these areas, and really thinking about new strategic ways to continue to grow our impact so that occupational therapy can be seen as a larger force within the healthcare, education, and community.
We stand in a unique moment in time, and we need to be able to advocate for what's happening in our profession. Occupational therapy leaders should be aware that we are living through a period of heightened awareness and imperative advocacy for occupational justice.
The trends in occupational therapy, I think we need to take advantage of, obviously, artificial intelligence, AI, that it's here to stay, it's here to play. And I think we need to look at the possibilities of what that means for OT practice, for OT education, for dissemination of knowledge. I mean, there's so many different ways we can be progressive with AI and technology and so many facets. So for sure, we need to tap into that and create opportunities for our profession.
I think we all realize what a amazing profession we're in, and we have an association that really supports us. And so how can we push ourselves forward to continue to grow? So we had lots of conversations around what was really going to be aspirational. And I think what was important in the work that we did is that we created a vision, but we also created some pieces that go with the vision to really help define it down a little bit more, some of those key components and themes that were identified through the research process that we did, and making sure it feels inclusive for everyone, but it also is really feeling aspirational and pushing us forward.
We provide meaning. We give back meaning. That is the beauty of our profession. And I really hope that 2030 inspires people to remember the power and the strength of occupational therapy and what that could mean if we take opportunities to push ourselves beyond our comfort level and grow in ways we can only imagine. That's my hope.